Good afternoon, everyone. Welcome to April office hours. We're going to be recording this session as always, so it'll be up on our website in the near future. And I will send the slide deck out after the meeting today for folks. So let's get going and get into the show here. So we're going to go over our health home designation review results. We just got those recently, so I wanted to share that with you all. Touch on policy and procedure, some children's program updates, COVID-19 related information, touching back on the quality notebook, some consent updates, and NetSmart updates. So as folks know, we just went through a redesignation, March 7th through 11th. Here are the entities that did the review for us. I would say there was roughly 16 people in all across these departments through the state that audited our program. And they did 3 domains. So the first one was us going over our own policies and indicating whether or not we felt we met the policy requirements that the state put forth, and that we had quality management tools or programs in place to support those policies. And then the state graded us on our responses, and they said whether we met or did not meet based on their review. And then the next domain, we went through just our regional performance measures that were, to our region for the health home. Every state region has measures that are held to. So we got the results for that as well. And then our chart reviews were samples across the actual network. So we had 50 adult charts reviewed and 34 children's charts across the network. And then based upon that, I just want to show folks our performance measures. So we met 12 out of 18 of the performance measures from our last review. Predominantly 4 of the 6 that we did not meet were around emergency department visit follow-up after those visits. So around mental illness and then around alcohol or other drug dependency disorders, the 7 and 30-day follow-ups. We did not hit those target numbers from the last time around. And then we got chlamydia screening was another performance measure on the adult side that fell a little bit under from where we were prior as well. And then the prevention quality indicator on the bottom was an area that we did not meet. So all in all, we did pretty well. We were state average, right around 67% for the measures on the adult side of the house. Our heart measures, the score was 67% as well, which out of 20 points was 13.4 points. On the children's side, I wanted to put a big congratulations out there. We're the first, I think I mentioned this last time, the first health home that the state identified for children's services to have a perfect score on their measures, which is phenomenal. We can't just speak highly enough about it. We're so excited. So I just wanted to put these up there for everyone so that you could see it. And again, we did very well overall in this category. So something to be very, very proud of, and all the good work that everybody's doing. So what does that mean? So the next part was the actual results. So we received on an adult program a level 4, which is a 2-year designation. And then on the children's side, we got a level 5, which is a 3-year designation, which is the highest. So we're really excited. We're a 4-star and a 5-star program overall. Keep in mind, don't shake a stick. We've got over 3,000 members in the adult program alone that we work with through the North Country, throughout all of our organizations in this network. So that's pretty darn good as far as I'm concerned to get a 2-year designation. We have some quality management things that we're looking at that we can always improve upon, that we'll be working on in that realm. On the children's side, we did phenomenal. We're just really excited, to get that milestone of a 3-year. As you can see in the key below, that's how they qualified those different levels for percentage wise. And, we're very fortunate to land where we did. So what we're going to be doing now is we have to do almost like a plan of correction, I guess you could call it, for some of the areas that they found throughout the chart reviews, through the performance measures themselves. The ones that we did not meet, we have to come up with, how are we going to try to close those gaps for those particular measures moving forward. And then back to domain one, how's our quality management program supporting those policies that the state puts forth, which we in turn interpret and put forth to our network. So we look at those things, and we'll continue to put that plan together. That's due back to the state by May 6th. So it's coming up, I think, next Friday. And then we wait to hear, what their thoughts are on that. And then, we go forward and we start implementing some of those steps. So hats off again, congratulations. I think it's great. I don't know if anybody had any thoughts, comments, questions, but we're just really, really excited. And, given the environment that, the nation, the world's been facing around the last 2 years around COVID, and the challenges we have, particularly in rural upstate New York, faced, just trying to continue to keep things going, keep staff in place so that we can provide these services and care management for folks. We did a phenomenal job. I mean, it's great. It's really good. So I'll get off the soapbox on it, but I'm really excited and proud to be a part of this network. This is cool. So there you have it. That's the results. We'll be following up with the individual organizations on any trends that may have come up specific to your agency charts that were chosen. We just have to continue going through that, and that'll be coming up in the near future. So we'll be in touch. But overall, everybody did really well. Okay. So from there, we go to our policies. We didn't have anything current because we did such a big update just prior to the redesignation. But on the right-hand side, you'll see we've got 4 in the shoots coming along. And when they do get to the point where we've posted them and brought them forth onto our website and published to the network, we'll make a point to walk through them within our office hours, as we had discussed a couple months back. And, we'll just give the opportunity for folks to have that mode of communication for it, and look at it almost as a training opportunity too, and for any questions that might come up. But I just wanted to ask if there's any questions at the moment on any policies that are out there for folks. If you had them, now's the time to bring them up, or reach out to us through our email if you have any questions. Okay. I'm turning it over to Jessica now. She's got some children's program updates.
Hi, everybody. I just wanted to make sure that everyone is adding the HCBS waiver sub-program in NetSmart. It's going to be under programs. You'll have your main program of either adult health home or children's health home, but then there's also a sub-program. And if you have a child enrolled in waiver, please make sure you're adding that sub-program. And then we are also working with NetSmart to be adding a high fidelity RAP sub-program and an early intervention sub-program as well. It's just taking a little bit of time. I also wanted to give a very exciting update, is that the Department of Health is looking at making the CANS a yearly assessment, not an every 6-month assessment. So that would also mean that the Children's Plan of Cares would move to an annual amendment versus an amendment every 6 months. This would greatly reduce some of the workload on the care managers. They are targeting this for August. However, nothing is written in policy yet. But as soon as we have more information or policy changes, we will let you know. Anyone have any questions on that? All right.
Nothing other than yay.
I'm very excited. I'm pumped. So some other news, we finally got, we had our feedback from our year 2 HCBS audit, but we finally got the state scoring, so we really didn't know where we sat with our year 2 HCBS audits. So below you can kind of see the area that was audited, what the score was for the state for year 1, what the score was for year 2, and then how AHI scored year 2. So the first, I just took some highlights out of the packet. We were scored in roughly 30 areas, so I didn't want to sit here and go through, 30 touch points. But freedom of choice forms that were completed and reviewed with our HCBS members, we scored higher than the state average. We were at 50%. Getting our initial level of care forms completed, you can see there that we scored 71%, which is higher than the average. The one area that we really aren't doing well in, which was kind of surprising, was our annual level of cares. We scored at a 57%. And actually year 1, we were at a 66%. So that, I don't know if that was a fluke or if we just had some maybe turnover at some of our agencies that have caused that score to dip a little bit. But we'll be having a retraining for staff coming up, so that'll be something that we talk about. Another big area was having our notice of decision forms in our records, and we are at 57% for that. So we are higher again than the state average there. Members with a plan of care that was reviewed that had adequate needs and goals that matched the assessments. So that the plan of care was developed based off of the CANS, based off of the HCBS plan of care, based off the comprehensive assessment. We scored 75% there, and the year 2 state average was 58%. So we're doing quite well compared to the state average. Having our plan of care process completed as required by waivers. So that basically means that our plans of care are for HCBS are being developed within that first 30 days because the HCBS plan of care does have a smaller time frame than your health home plan of care. As you can see there, we scored 66%, which is a lot higher than the state average. Plan of care has adequate and appropriate strategies to address health and safety risks. As you can see there, we again scored much higher than the state average at 50%. And then anytime a plan of care that was needed to be updated due to a change, we scored 50%. However, the state average was 86% for year 2. And they did not measure this year 1, so that's why there's only a year 2 score. So overall, compared to the state average for year 2, we are doing decent, which is good to hear because sometimes they throw out these percentages at us and I have nothing to compare them to. So it's good to know that we are making all of my efforts and your efforts are making a difference and our scores are improving. And go to the next slide, Travis. So again, just some highlights, not every single area. We did better than the state average. However, on these audits, the CMS requirement is 80%. So in most areas, we were quite behind the 80% as well as overall in the state. And if you looked at our year 1 scores, we did improve significantly from year 1. And we did have some areas that we scored really well in, especially with our family of 1 youth. A lot of those youth that are considered family of 1 are getting all of the services that they need to maintain their family of 1 status. And that's a big shout out to AMH because they have most of those youth enrolled in their program. So I will continue to work through individual audits. I have 1 left to do. Once I'm done with that, I'll meet with each care management agency to kind of review the results of those, and we will have another HCBS refresher training. And I believe that our year 3 audit will be occurring sometime this summer.
That's great, Jessica. Thanks for that feedback. Awesome results again. You know, we're above state average pretty much across the board on everything you indicated, and that's a good place to be. So we'll just keep on plugging away. Nice. Thank you, everyone, for all your work on all these areas. I know the HCBS waiver kind of came quick in a few years back and was a little clumsy rollout across the state. So to hear we're above the average is another nice thing. A testament to the good work that everybody does in the North Country. So thank you.
Pretty excited. Did anyone have any questions about any of the HCBS stuff? All right.
Thanks,
Go ahead,
Jessica.
Travis. Yep.
All right. So I just wanted to give a quick update on COVID-19. You know, the last time we talked about this, there was a potential extension through April, and then a DOH was going to be ready to pull back on the waivers. And we were informed during a state MCO, a DOH MCO quality meeting a week and a half ago or so, that as of April 16th, it was extended. The federal emergency was extended into July. So DOH is communicating the following still. You know, face-to-face is still encouraged when appropriate and safe to do so. Once the federal emergency does end, that verbal consent will go away. And, you know, just the same thing we've been talking about, you know, as you can now, we should really get back to business as usual as we're able to prior to the pandemic, as far as process, paperwork requirements, you know, getting those wet electronic signatures. That e-signature is something that's sounding as though it's going to stay. That was reiterated again by Peggy Elmer when she was talking to the group about it. And but, you know, verbal consent is still here, but it should be a last resort was the other thing that was reiterated. I put a link here just to the Health and Human Services Public Health Declaration that extended as of April 16th, the federal emergency for the time being. You know, I know people have been doing a lot of hard work around all this, but I just wanted to get some tabs up on it, you know, as far as where it's at the moment. DOH is in the process of putting a guidance document together. They will be sending that out across the state to all the health homes to get to the CMAs to pretty much help us with specific points when things are going to go back to normal, quote unquote. So like dates, timeframes, etc. So that's in the works from what we're being told, and will be coming our way in the not too distant future. Any questions around the specific to the public health emergency at this point? Okay. Same thing for OMH, specific to the Health Home Plus face-to-face. You know, that those flexibilities are still allowable, where there's a documented health safety risk having an in-person contact, and it's, you know, billable at the Health Home Plus rate. So, you know, those flexibilities will no longer be there once the public health emergency does go away. And I always bring this back. I just want folks to know that infection control manual is a resource for folks to take a look at when they're doing that risk assessment to document. There's a bunch of different items that can help a person make that determination when they want to do an assessment to do a face-to-face with someone. So that's the stance. OMH has been very, very standing on their 2 feet about this, that face-to-face is going to be expected when the federal health emergency goes away. They do acknowledge that it's very challenging in some areas of the state, in particular rural areas where, you know, staffing is an issue, and you know, we're not able to get staff in place to do the service, to do the work. But yet they're still holding strong. You know, the high risk population of Health Home Plus, in the view of OMH, is to have those high contacts, those 4 contacts, 2 of which are face to face on a monthly basis. So just wanted to make sure I relayed that information to everyone. If there's any questions or anything you had around that, you know, please reach out, or if you want to bring it up now, we can talk about it now. But that's where we're at with this information. Okay. Quality notebook. I just want to bring this up. This came up last month that we started sending them out to the organizations. Just wanted to touch base on how that's going. Are they a helpful tool for our supervisors out there? Just a reminder that that plan correction piece, we are expecting a response back on status or if there's challenges so that we can work with you on it. So just wanted to get a sense of how people are feeling about it since it's a new thing that we've put out for everybody.
Hey guys, it's Renee with Alliance. So first of all, whoever's Excel skills are setting up that notebook, high five. I love that you link from the front like cover sheet to where the data is. So thank you very, very much. We appreciate that. On the other hand, we are we're gathering information on our end at Alliance because there does feel like there's some data inaccuracies in there, and that it might be related to what's coming out of DataDen because we're also finding a lot of inaccuracies in DataDen. And the reason why so I just don't know if anyone else is feeling that. I think part of it, I mean, because there's obviously a ton of different data points that are being put into this quality notebook, and they're probably coming from a million different places. So what we want to do on our end is get like sort of like a better list of what's going on that we're seeing so that you guys can take a look at it as well. But just for some overview examples, we're definitely finding that like our health home billing percentage is not accurate on that. And I think that that is because our internal our internal process of approving Health Home Plus HMLs has like sometimes up to 3 people looking at it before it's finalized. And that means that sometimes those HMLs aren't finalized in MAP until like mid-month, like the following month. So if it gets pulled in the first week or so of the month, there's going to be a whole bunch of them that aren't finalized and sent to MAP yet. But the other things that we're finding primarily in DataDen is that it'll show us clients that say, for instance, have an overdue comp. But then the manager goes into NetSmart and looks, and there's a finalized completed comp that's like 6 or 7 weeks old. So we're sort of gathering some stuff, and so it's also related to some stuff about identifying Health Home Plus folks. But because another, for instance, is the number of Health Home Plus folks that was listed on our quality notebook. We're like, well, we don't have that many. And then we actually found 2 or 3 that we had not identified as Health Home Plus, but they're people who've been on board with us that aren't coming out in psyches reports. So there's a lot of different issues. So I'm sort of getting together like some psyche stuff so that I can talk to like Prabhu about that. But this is a long spiel, but first, like most importantly, we love the quality notebook. We just want to make sure that it's got accurate data in it.
That's what we're looking for, that type of feedback. So Renee, I really appreciate you stepping up and opening it up. Accuracy is important. We want to know if there's any trends or issues with that data not being current, because then we can go back and look at that as well and correct where there's issues. I'm not going to take props for the Excel skills. That's Taylor Dawson. So I have to give her a shout out. If they're that cool and work that well, she gets the credit. So
yeah, we know it's Taylor.
But yeah, so we are pulling from various data points to get this together. Some is coming from DataDen. So we've noticed that as well with our internal CMA, that some of those plans that are showing up are maybe in the system already in NetSmart. So that stuff we're working out on the DataDen side to get, to ensure that that's the most current information going in. So the billing percentage piece too, you're right on, depending on when that billing submitted, because you technically have till the 10th day of the next month to submit the billing per policy, that's going to throw potentially what those numbers might be depending on when that report was pulled, right? So, those are the types of things that, if we get that communication, if there's a a big stark difference from what you're seeing on your end when you're looking into it. That's the communication we want to be able to have with you, because we're not looking at this as a punitive big brother tool. It's more of a tool to help your lives easier as you get into it. But also it's a proactive, we're looking at it as a proactive, not a reactive thing, right? So the idea is that these notebooks are eventually going to be a proactive tool for folks, so that we're not chasing down these types of things after the fact when they're overdue, et cetera. Um, any other input or thoughts around the notebook itself, Renee? That was valuable feedback. Thank you so much.
Travis, I just want to clarify, it's the 10th of the month following the month you're billing for.
Yes. Did I say prior?
No,
I
it's
misspoke.
no, you said 10, but I just wanted to clarify. So any billing for the month of March should be completed by April 10th.
Yes, that's per our policy. Yes. So it can vary. So if let's say we pull a report on our end on the 3rd, and you didn't do the billing on your end until the 7th, it's not going to show on that report at that point, right? Because the days are not lining up. So, and that's not a bad thing, because it's just you're following within policy still. But it's something that we could look at if there was a stark difference. But typically, we're hoping that there's not going to be a stark difference, because generally most people get that billing in, by the 3rd of the month in a lot of instances. But that's not everyone. But, again, those are areas we can talk through. They can be adjusted when we have those discussions. It's more looking at the glaring, indiscrepancies, the glaring issues that might be coming up that we want you to be aware of through these reports. But on our end, we want to hear that feedback if it's not jiving, if it's not accurate from what you're seeing when you're looking at stuff. Is that helpful?
Yeah, thank you very much. I think it came out, I think, Taylor, you sent the last one out on a Friday afternoon, and our executive director and program director opened those emails up over the weekend, and you better believe Monday morning we heard about that Health Home Plus billing percentage that wasn't accurate, and I'm like, whoa, no. So we were we were made abreast of so anyway, we want to make sure our executive director doesn't see inaccurate data for our program. But it is a super helpful tool, and I know it's going to take all of us to sort of iron it out and make sure it is giving accurate data.
Absolutely. And when I made the comment earlier too about, if there is a corrective action that needs to happen, we are expecting that the organization that has that potential corrective action is addressing that. So we don't want it to be unaddressed, because then that leads to bigger issues, other potential billing issues, quality issues. So, given the circumstance, we'll have to follow up accordingly. But that's not what we're looking to do. But, we have to also have a quality oversight. I mean, we just went through this redesignation. Quality management program was a big thing. They were diving deep into that, especially on our adult program. When you got 3,000 plus members on the adult side, they're turning over the rocks. They're looking, what do you have in place for checks and balances? So, this is one of the things that we had in works already, but it's one of the areas that we're going to help to, put those checks and balances a little bit tighter than what we might have had in the past. And, we're relying more on the technology to do that, but the goal is to make it easier for everyone involved. So you're not waiting a month or 2 months or 3 months for information. It's coming more readily, and in a sense that it's more in one place to find it. You're not going to 5 or 6 different places to find it. And with the goal of it's going to make life easier for folks. Any other thoughts, questions around the notebook? So far we're hearing it's good. We just got to tweak some stuff, communicate with each other when there's questions. All right. Keep us posted on it. Thank you again for the feedback. Jessica, you're back.
Hello, I'm back. All right, so we have some consent updates happening. The Department of Health has updated the Children's 5201 for youth consenting who are under the age of 18, so they are not self-consenting. So any self-consenting youth or anyone over the age of 18 will still be completing the 50-55, and anyone under that will be completing the 5201. But the new form has a new look to Section 2, and a new tracking form. This, like I said, is set to go live on 5/1. I will be sending out a email that has all of these new forms in it, so they are located in one place, but you can find them on the Department of Health, their website. They're all posted there. So any youth that enrolls on 5/1 or after, we're going to use the new 5201, which comes with a new FAQ document as well. So make sure that you have the newest version of that. All other youth who are currently enrolled, we have 6 months to update their current consents. So if you have someone who has recently enrolled and completed the old form of the 5201, you will have to update that to the new version. And what the state is saying is best practice, and what will follow is when you go to update the CANs over the course of the next 6 months when they're due, also take a look at their health home consents and make sure that they have the newest version. So updates to the 5201 that are very exciting are that the 5201 will take the place of the 5200 and the 5230. So we no longer have to have the children's enrollment consent signed, the DOH 5201, and you no longer have to have the functional assessment consent signed, that 5230. Those will be phased out as of 5/1. The consent for enrollment and the consent for the functional assessment are now contained in the 5201. Another exciting update to the 5201 is that it now includes psyche's consent, just like our 50-55. So for youth who are signing the 5201, the parent, guardian, medical consenter, they now no longer also have to sign a separate psyche's consent for that population. It is contained right in the 5201. Like I said earlier, because we have a new version of the 5201, the FAQ that goes with the children's consents did need to be updated to include these changes. So there is a new version of this form. Like I said, I will email out everybody all these new forms and guidance, but you can find them on the Department of Health website currently. Next slide. So the new section on the section 2 on the 5201, it is still consenting for the same information and services with our youth. So that would be family planning type services, mental health services. The information and the consent on section 2 is still the same. It does have a little bit of a new look to it, but the consent process is still the same. The one thing that is new is the snippet that you see here is the health home care management tracking form for section 2. So currently, if you are working with a member and for whatever reason they are not consenting or will not complete section 2, we all have to kind of remember to make a note on there, put a note in the record. You have to remember to do that outside of the form to indicate that the client has refused to sign this document. So what the state did is they developed this tracking form for us to use. So every time you complete or update a 5201, you will have to complete this tracking section of the 5201 if the member has not consented or reviewed section 2. Now in section 2, they may not have any providers because they may not be receiving any of those services, but they still signed it and reviewed it. They just don't have anyone to add there. This would be in the instance of that they're not receiving any of those services. It's a part of the consent that we discuss with the child, with the adults not around. So the parents sometimes will refuse to let us speak privately to the children about these sensitive subjects. So you would just mark that permission was denied. The child's just simply underage to complete Section 2, or the child was not able or not willing. So this could be if you were working with a youth who refused just to talk to you, because we have that happen, or we have sometimes youth that are, maybe 15, but developmentally are quite young, and it just wouldn't be appropriate, and they wouldn't be able to comprehend and complete Section 2 with you. So this is not part of the 5201. It is a separate tracking form. So when you're uploading into NetSmart Come 5.1 with your new forms, you can either upload this all together or you can upload it separately. You can go to the next slide. So also with the consent changes that are happening, the DOH 5059 is no longer required. A withdrawal of consent for the 5201, so the 5202, and the withdrawal of consent for the 5055, so that would be the 5058, are no longer required. So there will be a new 5055 coming out. It is in draft form right now, and I believe it's under final review with the lawyers at the state. Moving forward, we will no longer be required to complete withdrawal of consent forms if a conversation with the enrolled member, parent, or guardian has happened. If you have a conversation about graduation or disenrollment and they understand that they're disenrolling from the program, they're graduating from the program, and in writing, so as part of the discharge process, you send them a letter because you've had a conversation with them, and you send them a letter noting that they have disenrolled from the program and their information sharing has ceased with disenrollment, then you do not have to complete a withdrawal of consent form. However, in instances where we have a member who goes potentially into diligent search and we cannot engage in a conversation with them about disenrollment, we still have to issue that 5235 document. The state has updated their policies to reflect this change. We have not yet, but I will be updating our informed consent policy, and I will be updating our disenrollment policy to reflect these changes. So there's a lot of information on consent updates. Again, I will be sending out an email with some DOH guidance plus new forms in there. But does anyone have any questions? There's one in the chat. So Sarah asked, is it children and adults for the withdrawal of consent? Yes. So moving forward, an adult nor a child will be required to have signed a withdrawal of consent form if they graduate or disenroll from Health Home, if and only if a documented conversation has occurred and they were issued in writing a letter from your CMA stating that they are no longer enrolled in the program per the, disenrollment meeting that occurred on such and such a date. And as part of our disenrollment policy, we will probably come up with a letter, a draft letter, an example that your CMA can use and make their own, or each CMA can draft their own letter stating that the member has either graduated or disenrolled, and this is their written notification that they are no longer consented to be in the program.
Is there any rule that you can't just continue to use them if it's easier than mailing them a separate letter? That's whatever,
That was my question too, Lori.
you know?
Well, I would say no, Because right now, if you mail someone a 5202 and they do not return it to you signed, you then have to send the 5235 anyways, because they haven't withdrawn their consent yet. So instead of mailing out these forms, and if you have a face-to-face meeting with them, you could just, and you're graduating them, you're going prepared with forms anyways. So whether it be a 5202 or a letter, you'll still have to issue the letter, because the 5202 does not go with the new 5201.
Oh, so no matter what, you have to mail a letter.
They have to be issued in writing, yes, because the 5202 as it exists today matches up with the old 5201 that will cease to exist at the end of this month.
Gotcha. Okay.
All right. Thanks for all those updates, Jessica, on the consent. I know it's a lot, but there's going to be some relief for administrative burden there once everybody gets used to the process. So that's a good thing. And hopefully when 5055 comes around out of its draft form, that's a nice change for us as well. We'll have to wait and see that, but we will find out. So I saw the chat. There were some questions that were thrown out there by a few of the supervisors. I saw Taylor responded in regards to not receiving the quality notebook. So we're definitely double check on that, make sure it was sent to you. If it wasn't for some reason, we deeply apologize. But if it was, we'll resend it just to make sure that you have it on the top of your list. And yes, please keep those, any observations from it, data and deficiencies, et cetera. We definitely want to know that so that we can look into it on our end as well to make sure it's a better product for everybody. Cool. Any other questions or chats up to this point before we go on? All right. So data then, I did want to make one additional comment to Taylor's chat response. So yes, there's only 2 organizations right now that we've done a soft rollout with. And part of that is because of some of the work we're doing on the back end with the platform with a third-party vendor right now. So once that's complete in the coming months, then we'll be at a point where we can roll it out network wide. So there's been a pause in that. We originally wanted to do this last year, and for various reasons it got held up. But we're back on track. We've got a scope of work with this third-party entity. We're working with them. We do weekly connections with them. They're helping us do the data transfer, making sure the platform's getting consistent, accurate data, which we're obviously hearing that that's not always the case. So those are the things we're working on with this vendor to tie everything together. So the final product will be that it will be network wide. Once all this stuff is done. So that's why not everybody has it at this point. Okay, so we talked about NetSmart category tab update. We had a request after we went live from our last office hours with these form indicators. We have now included the Psyche's clinical summary and signed plan of care categories. So the desk guide's been updated. I will send that out this afternoon along with today's slide deck from today's office hours so folks can have that. And it is active in our production environment in NetSmart as well. So it was just a couple additional things we wanted to get out there based on a request. So folks will have that moving forward. So hopefully this has been a helpful thing when folks are going in, just trying to identify consistent documents when they're uploading in attachments. Definitely help for auditing, that's for sure. Whether you're auditing for your own organization or if we're doing an audit as a health home or being audited for that matter as a health home. I wanted just to put a note in about our care management partner website. We're working with everybody. I know Taylor's been in touch with just about everyone at this point, supervisor wise. If not, she will be shortly. We just want to make sure that this webpage is accurate. It's been a couple of years since it was last updated. So we're asking that folks, just take a look when Taylor does reach out with the specialties that you have listed for your organization within that website page. We work with a third-party consultant for our website updates. So once we get everything up to snuff, we'll get it to that consultant. They will be updating the webpage to make sure it's all tried and true and accurate for folks. So just wanted to put that out there. Please reach out to Taylor if there is any questions or anything that you wanted to see changed or added, and we'll make sure that happens for you. And then we're working on we have a AHI Health Home brochure that was put together a handful of years ago. So we're just working to update that. It's got some generalized health home information, but it also lists all of our providers in the network. So that's one of the reasons I wanted to make sure that we had it updated, refresh, revised. So we're going through and we're getting that up squared up for folks, and we'll have that available in the near future for everyone as well, just to use if you ever wanted to use it as a supplement or for marketing for your own purposes when you're out there doing any kind of community engagement. If you want it as a supplement to your own organization information around health home care management. But just to give you an FYI, we're working on getting this up to snuff for folks for the network. And an update on our providers within the network. So we're going to be onboarding Waite House. They're going to be specifically a children's provider. They're out in the Glens Falls area, and we're very excited for them coming on board. We're actually going to do our onboarding with them next week. It's going to be our first in-person onboarding that we've done over the last couple of years. So we're excited about that. And, we're hoping to get them up and rolling here in the next month or so and have them attend our next meeting next month for office hours. They're very excited. They've been waiting a bit to get up and running, and they're just finishing up with all the red tape of becoming a provider through the state to be able to be in our network. St. Joseph Rehabilitation Center and People USA, they're both been given approval at this point to pursue their MMIS ID numbers. And once that happens, they're in process of that now, then we'll be able to get them linked into the state systems and platforms and do their onboarding. So in the coming months, we should have 3 additional organizations on top of Lakeside House who came on board earlier this year. So we're excited about the growth. We're excited about getting, some other organizations in our network to make us even more robust as we're out there doing our work and getting people linked to services. So that's our update as far as providers in the network. And just want to make sure you had that information. And that was it for today. I don't know if anybody had any questions or thoughts that they had for us. As always, please reach out. We try diligently to get back to folks. The health home email typically is the best way. I know some folks had a little lag there a couple of weeks back with some responses, so we do apologize for that. But please continue to reach out. We will be in touch and respond as quick as we can with anything you have. Anything anybody have today that they wanted to talk about or anything additional?
Hey, Taylor, this is Bob at Essex County Mental Health. I was just looking through the reports again. There's a reference to members in DSE as far as activities. What does DSE mean?
Taylor, do you want to take that or you want me to?
Taylor, it's Jessica. Taylor had to hop off the call because Store Tech was calling her, so she needed to take that. The DSC tab that's in that quality notebook refers to members who are in diligent search. So we're looking at members who have been in diligent search, and in order to bill for diligent search, and once you put a member in diligent search, you're supposed to complete 3 activities per month to attempt to locate those members. So we want to make sure that anyone that's put into that status has those 3 attempts every single month to re-engage them in health home care management. And if you do all 3 of those things and they are billable, you can bill for your efforts. So So that's what
three
that,
activities. Mm-hmm. I'm sorry. That's 3 activities per month for 3 consecutive months.
correct.
Yeah, okay. Thank you.
Absolutely. Any other questions or anything anybody want to talk about?
Hey, Travis, this is Rui. Can you hear me?
Yes. Hi, Rui.
Hi, just wondering if you had any updates or confirmation on the state budget, especially with the removal of the 1.5% rate reduction.
I have not gotten anything on the 1.5%. I know there was some information coming through on care management staff bonus monies potentially, but I haven't gotten detail around that specifically as far as how that looks, what that means. But there was some information that came through saying that that potentially went through the budget process. So as we get more information, we can relay that out to the supervisor group. I think there's an application process that goes along with that as well, but it wasn't defined from what I had saw. So, you know, I imagine there's going to be a step or two anyways if there was an organization interested in that information.
Thank you.
Yes. Anything else anybody had?
Can I just chime in that this is Lori from AMH. I attend a lot of meetings throughout the month, as I'm sure you all do. You know, this is one of the ones that I don't actually dread coming to. I find it very informative. You guys are like, you know, focused on task. It's clear that you're always busy trying to make these improvements and implement the new things that need to happen and to create all these different platforms and different avenues to support all of us in the work we do. And so I just want to say it again, you know, how great it is to have this team to work with together. So, you know, thank you for not making this an hour from hell every month. I appreciate it.
That Lori, that response is so you. There's no one else who could have said that better. But I also agree. This is not a meeting that I schedule over because I do find it really helpful. But yeah, so there's never enough thanks. We should always give them out. Just give it out.
Well, thank you. We want to be here with all of you, so thank you. So, and we appreciate the partnership. A great example is today's quality notebook discussion. I mean, you know, there's things we need to know and work on our end so that we can provide you better information and a better service, you know, as we're asking things of you as well. So, you know, I think it's a partnership, and, you know, every partnership has give and take, and I think it's great. Thank you so much for those nice words. I know our team appreciates it for sure. All right, awesome. Well, anything else anybody had? If not, as always, thank you for all you do, and I hope you have a great afternoon, and we will be in touch soon. Take care, everybody.
Take care, everyone.
I